Good morning, everybody. Thank goodness it's Friday, and we are so delighted to be here with you today. What a beautiful place it is. It's so lovely. I can't tell you more how lovely it is, and we're excited that you're joining us and that you're here with us and that we are here. So, BOHMAC, B-O-H-M-A-C. People will say to me, what's that? BOHMAC, right? Better Oral Health Massachusetts Coalition. It's a statewide organization promoting oral health for the people of Massachusetts. So like I say, I'm delighted. I'm chair of BOHMAC. I'm also a registered dental hygienist. I practiced for 34 years in clinical. I'm an educator at Mass College of Pharmacy, but in the Boston. There's two campuses, Boston and Worcester. In fact, some of you got to meet Dr. Tracy Moore. She is an educator right here at MCPHS in Worcester. Louanne Chester, you might have seen. She's a practicing hygienist in the state of Massachusetts. And then also Samantha Smith. She's a dental hygienist, but she also is a graduate student. And guess what? She designed this beautiful PowerPoint that you're going to see today. And then we have Dr. Lisa Thompson from Harvard Dental School. And then we have Dr. Abadiz. I'm sorry, I said it wrong. But guess what? We're all going to speak today, so they can actually also mention their name. So we are so delighted. We're going to talk about oral health today, and Samantha Smith is going to start you off.
Good morning. Can everybody hear me okay? We're good? Okay, perfect. So my name's Samantha Smith. I am a certified dental assistant. I'm also a registered dental hygienist, as Lisa was mentioning. I'm a graduate student, and I'm working on my master's degree. So we're almost there. All right. Yeah. Master's degree for dental hygiene. Yeah. All right. So we're going to go over the importance of oral health. So this is that oral educational workshop. So some learning objectives we're going to be going over today. First, the importance of your oral health and how it pertains to your overall health. We'll go over some oral diseases and manifestations. We'll go over oral health conditions that are commonly seen in older adults. We'll go over some prevention methods, so what you can be doing at home, hygiene, different things there. We'll go over Medicaid coverage, insurance coverage, and then we'll give you some local dental resources. All right. So oral health is vital to overall health. Your oral health is more important than you might realize. So today you're going to learn how your mouth, teeth, gums, all of this affects your general health. All right. So what is the link between oral health and overall health? So like any area of the body, the mouth is full of germs. If we're not taking care of that, that can kind of lead into other areas of the body. So most of these germs are harmless, but the big thing is your mouth is the entry to your body, and also the digestive tract and respiratory tract. So sometimes the germs in the mouth, they can lead to disease throughout the body or go to other areas of the body. So good oral hygiene, brushing, being consistent, brushing, flossing, seeing your dentist, all of this helps prevent that transmission of bacteria. So without good oral hygiene, germs and bacteria, they thrive and grow. All right. So what conditions can be linked to oral health? So there's a few here. I have some bigger words, and then we'll kind of go over it. There's endocarditis. So this is infections of the heart chambers or the valves. So germs from the mouth, as we were saying, can go to other areas of the body, and they can also attach to areas in the heart. So if our oral health is not on top of, if we're kind of not, being seen regularly or taking care of our oral health at home, that can lead to some different conditions such as endocarditis. So this picture shows you a little bit, just to give you a visual of, endocarditis. It's kind of showing you what can happen in the heart, that breakdown of that tissue there. So cardiovascular disease is another one, or heart disease. So studies do suggest heart disease, different clogged arteries, strokes. They can be linked to inflammation and infections that start from the mouth. All right, just a few other conditions that are linked to oral health. Pregnancy and birth complications, periodontitis or gum disease. These can be linked to premature birth or low birth weight. Another big one, pneumonia. Germs from the mouth can easily be transferred to the lungs. So if there's fluid and bacteria in the lungs, this can be linked back to oral health. Cancer. A number of cancers are linked to diseases or gum disease from the mouth. Like I said before, the GI tract, lung, breast, prostate gland, uterine cancer, they can all be linked back to oral health. Alzheimer's disease, this is something too, as the disease progresses, sometimes our daily hygiene on our own can be declining. And then HIV and AIDS, so these can be common with oral problems such as lesions or sores that start in the oral cavity. All right, here's another one too, diabetes. So this is a big one. Diabetes makes the body less able to fight infection overall. Diabetes puts the gums at risk. Research shows people who have gum disease have a harder time controlling their blood sugar levels. So everything is linked here. Gum disease also, it occurs more and can be more serious in people with diabetes, especially uncontrolled, just because, like I said before, fighting infection is a little harder naturally. All right, and I'm gonna give it over to one of our others.
Right. Can everyone hear me? Okay. So I'm Gasser Abdelaziz. I'm a second-year student at Harvard School of Dental Medicine. I'm very delighted to be here with you today. Apparently, I'll be speaking to an audience who's way smarter than me. So I'll make this quick, and we need to have enough room in the end for all of your questions, and we'll be delighted to answer all of them. So when it comes to dentistry, the three most common diseases that we have is basically gingivitis and periodontitis, which we just like call them gum diseases. And this is like the red soft tissue that you see once you open your mouth, and it covers your teeth and your bones of the jaw. And we have caries, and I'm sure like everyone has experienced caries at some point in their lives, including myself, after joining dental school. So if that means anything, we know what's happening there. All right, so first is gingivitis, or gum disease. So our main culprit in dentistry is plaque. Every time we go to a dentist, we'll be like, you have to brush your teeth so that you can remove plaque off your teeth. But no one explains to you what is plaque. Plaque is more than one thing. It's mainly bacteria that is already present in the mouth, and this bacteria could be good for us, and in certain situations it's bad for us. The second thing is food and debris. So the food that we ingest and we chew in our mouth, some of it remains as remnants, and it's fermented, or it's being eaten by the bacteria that we already have in our mouth. And as a byproduct of this is that the bacteria secretes toxins that could affect our gum or teeth, which could lead to gum disease or caries. So that's basically what's happening in a nutshell. Gingivitis per se occurs first before periodontitis happens. The main difference between gingivitis and periodontitis is that gingivitis is just like this tissue, and periodontitis is the tissues that cover the root and attaches the root to the bones of our jaw. So it always starts with inflammation or redness and bleeding in the gums, and then extends into this tissues, or the periodontium that we call. It's just like tissues that cover the root and attaches it to the bone. That's why as the disease progresses, we find that our teeth become loose. It's because this inflammation has extended from the soft tissues on the outer side all the way to the tissues that cover the root, and that's why it becomes loose and then it falls out of the mouth. And the third thing is tooth decay, which is caries. Again, it's because of plaque. So this plaque, which contains bacteria that eats the food that we have and that we don't brush, it leads to secretion of toxins. And when these toxins come in contact with the teeth for long enough, it leads to decalcification, or what we see as a result of that, which is cavitation. The prevalence of gum diseases is very common. There's like all of the stats over there. I don't remember them on top of my head, but it's very common, especially amongst the elderly. And nowadays, because of sugary foods and our poor dietary habits, is becoming more and more common among younger people, which makes them more susceptible to losing their teeth, which is unfortunate. Okay, so again, at the first tooth, on your left is healthy gums, where you basically, whenever you eat, you're brushing your teeth twice a day, you're using fluoride toothpaste, and everything goes according to plan. And then gingivitis starts to occur. But if you notice the difference between gingivitis and periodontitis is that the pink tissues have started going down, or what we call receded. So what happens is that as the inflammation progresses from the soft tissues on the outer to the tissues that cover the root, it starts exposing the roots, and as long as you don't take care of that, it will keep going all the way down until it reaches the last part of the root of the tooth, and that's when it becomes loose in the mouth. So that's why it's very, very important that we try to stop the disease progression at this point, if not even earlier, or prevent it from beginning in the first place. This is also another representation. It's one of the diagrams that they show us in dental school. The first tooth is also a healthy tooth and gum. And then the yellow cuff around the tooth is that plaque, which is composed of bacteria, food remnants, toxins, etc. And this is what we usually do when we brush our teeth, is that we take it off of the teeth so that it's not in contact with the tooth enamel or with the gums, or when we go to a hygienist or a dentist and they perform a prophy or a cleaning, is what they take away from the tooth so that it's no longer in contact there and it's not going to cause any inflammation. And the third picture, again, is once the inflammation has extended towards the bone and more towards the root. So this is gingivitis. The most common sign of gingivitis is bleeding. In the dental office, it occurs when we start probing your gums, which is painful. We train on each other in dental school, and we don't like it, so we get what you feel. It's horrible, and we're sorry for that. Also, you can notice it once you start brushing your teeth. So that's why dentists would ask you if you've ever noticed bleeding once you were like toothbrushing or when you were flossing. So this will be the first or the earliest sign that there's something wrong going on there. The second disease is periodontitis. As we can see in the diagram, we have like this metal rod, which is being poked into the gums, and that's us, going towards the root. And as you see here, this yellow shape that has like small circles in it, that's supposed to be the bone that covers the root. So once the inflammation has extended all the way, it starts off in the soft tissues, and then it goes down because it keeps progressing because the plaque is still there. So as long as the plaque is still there, this inflammation is going to continue. And it keeps extending, resorbing the bone right here, and resorbing the periodontal tissues, or the tissues that encase or cover the root and attaches the tooth to the bone. So as you can imagine, when all of this is being destroyed and it keeps continuing until here on both sides, that's when the tooth becomes loose. So if we can remove this, the main factor that's causing this disease, which is plaque, we can stop this from progressing forward, or we can prevent it from the beginning. You want to take a photo? Yeah? Okay. All right. Also, as the soft tissues start resorbing, as the bone starts resorbing and the soft tissues is inflamed, what happens is that these tissues are trying to run away from the cause of the disease, which is the bacteria and the plaque. So the soft tissues will start receding or retracting away from this bacteria. And that's when you start seeing the root surface on the tooth in your mouth. So as you see here in the picture, the gums have started receding away from the plaque so that it doesn't want to be in contact with it. It's trying to fend itself away from danger, basically. So we have recession, and in order to treat that, it could be very complicated down the road. So these are some signs that you might developing gum disease. You could have a bad taste in your mouth that will not go away. You have a constant feeling that you have a bad breath as well, which could be common. You could have sensitivity to temperatures or sugar on your teeth, and that's the result of not having tissues covering the root surface, because the root surface, if you think about it, is not intended to be exposed to the oral cavity. It's supposed to be covered by soft tissues and by bone. So once that is exposed, you start having sensitivity when you're eating or when you're drinking. You could have painful chewing as well, because as you can imagine, if the bone around the root has been eaten or has been resorbing, you don't have enough support for the teeth as you used to. So when you start chewing down and eating, it might feel a bit painful because now the support for the tooth has been compromised. You could have tender gums. You can use your finger or when you're brushing your teeth, and when you apply pressure on your gums, you could feel that they are tender or a bit painful. And of course, you would have bleeding gums. Bleeding gums could occur either provoked or unprovoked. Provoked would be when we try to probe it, or when you're brushing your teeth, or when you're eating something. Or it could be bleeding spontaneously without even provoking it, which could be a sign of severe inflammation or other diseases. Sure. This one? Uh-huh. Okay. All right, so the question is, how can you tell that you have tender gums? So we've all had healthy mouths at some point, and you know that your mouth shouldn't feel painful if it's free of disease. So if you hold your index finger, toothbrushing, and while you're brushing your teeth, if your brush comes in contact with your gum tissue, and you can feel it, and you can feel that there's pain there, and when you apply pressure with your index finger, it either makes the pain better or it makes it worse. That's not normal. Usually this will be accompanied with bleeding as well, so this would be a good sign. Sometimes your gums might not be tender, but it will bleed. That don't have gum disease. It means have gum disease because we're all different. We don't all feel the tenderness. You're welcome. And the last thing, and this is the most common non-communicable disease in the world, is caries. Tooth caries is, again, because of the plaque. It can occur at any surface of the tooth, or it can occur on multiple tooth surfaces. So as we see in the picture, it could occur at the surface that we use to chew food on. It could occur in between teeth, and that's very common because this area is very hard and difficult to clean, and that's why we instruct our patients to floss, because the bristles of the toothbrush cannot get in contact in between the teeth from the sides of the tooth. Or it can occur on the root surface. But again, you would only develop root caries if you've had periodontitis, which has led to recession of the soft tissues, and then the root has been exposed to the oral cavity, and that's when you start developing caries. That's why it's a good, I would say it's a good sign for us, or a bad sign, when we see root caries, that we identify that there's other diseases going on in the mouth. So if we can prevent that from happening from the beginning, again, it's going to be beneficial for all of us. So the process of tooth decay that when we were young, even when I was in school, everyone would tell us, oh, don't eat sugary foods. The problem is not the foods or the sugar that we eat by itself. So there's a chemical process that occurs. It's not the food that's causing the caries. It's the toxins or the acids that's being secreted by the bacteria in your mouth when in contact with sugary foods that leads to the decalcification of your enamel. By decalcification, I mean resorption of your enamel, which then you can see as caries. So you eat sugar candy. Sugar candy, when it comes in contact with the bacteria that is normally present in your mouth, releases an acid, which is called lactic acid. This acid resorbs the enamel of your teeth. And then when you don't brush your teeth, it keeps resorbing until it reaches all the way to the pulp and the nerves inside your tooth, and you start developing toothache. So that's what's happening. So we advocate against eating and drinking sugary foods a lot, but at the same time, if we brush our teeth, we would eliminate that acid. But again, it depends on how often we're eating these foods, because this acid is going to be whenever we eat anything. But there are certain foods that are more beneficial for us, such as vegetables, because they do not produce as many acids or cause this kind of like resorption of the teeth. Okay, so that's it. Thank you.
Okay, oral cancer. So please know, yes, unfortunately, oral cancer is prevalent in our world. Sorry, in our world. Most cancers most commonly begin where they're flat. We don't even see it, and that, or even feel it, know it's there. That's why I say it's so important to go for your regular checkups. Let a professional, a dental professional, do an oral cancer screening. This is when it's, progressed cancer. Most oral cancers are squamous cell carcinomas, which is, it spreads very quickly. So, and half of the cases are in persons older than 65. So many of you, just like me, I haven't had the opportunity to have the HPV vaccine. The young generation, luckily, does have that opportunity to have that HPV vaccine, which hopefully will change those numbers of oral cancer. So, how does it begin? It can be a white lesion, it can be a red lesion. You might just feel a bump in your mouth, might be irregular. Sometimes you might feel some pain, but that's when it's really, progressed. You probably won't have any symptoms at all. It can appear anywhere, can appear underneath your tongue, can appear on your hard palate. We just don't know, the back of your throat. So, and it does, what are the risks? Our older adults, right? Older age, alcohol, tobacco, HPV. So it's very important, as I can't emphasize enough. Yep, go ahead. Yeah, yes, human papilloma virus. It's a virus, yes. So when to see your dental professional? Like I can't emphasize enough, you want to make an appointment for a dental exam, by a dentist. A dental hygienist can perform, they call it intraoral, extraoral examination. Even, just regularly, whether you come every 3, every 6, they will do that examination for you and look for any patches, any white lesions, any red lesions. And this is the screening that they'll do. They actually divide the mouth up. They'll check the front tissue right underneath your lip, below, underneath your lower lip. They'll pull up your lip there and look underneath. They'll look in your cheeks on the side. They'll actually, look at the soft palate, the hard palate. And they'll look all around your tongue. They'll palpate your tongue, making sure there's no bumps, nothing there. Look the side of your tongue and also the floor of your mouth. You can do that yourself. There is a self-examination. You can look inside your cheek, pick up your lip, lower and top lip. to see, do you see anything, a red lesion, a white lesion? So, so oral health conditions in older adults. Dr. Thompson.
Hi there. I'm Lisa Thompson. I'm a professor in geriatric dentistry at the Harvard School of Dental Medicine, and it's a pleasure to be here. So I also welcome questions if you have it during this presentation, but I'll be talking about oral health conditions that are most common in older adults. And so when it's first talk about xerostomia or dry mouth, and I'm just going to list them right now and then we'll go into more detail. Stomatitis, or an inflammation of the tissue in the mouth, edentulosum, or tooth loss, and then tooth wear. So xerostomia, or dry mouth, is a really common side effect of medications. Most medications have the side effect of dry mouth, and most older adults are taking 5 or more medications. And so this causes variation of mild to pretty severe dry mouth. And unfortunately, there's no cure for dry mouth. It's more about managing it. So medications is really kind of the primary cause of dry mouth. You can have other diseases or syndromes like Sjogren's syndrome that might actually stop the production of saliva. But again, the primary cause of that dry mouth is medications that decrease the flow of saliva and dry up the mouth. Yeah. Mm-hmm. Mm-hmm. So the question was, even if you take 5 or 6 medications and you drink a lot of water, will that help? So we'll get into some of those details, but yes, one of the recommendations to manage dry mouth is to drink more water or rinse your mouth out. So again, salivary function, or the production of saliva in your mouth, is slowed or non-existent, and this is typically if you have a syndrome or a disease. Just because of age, you don't typically reduce your saliva flow. It's usually because of medications. So because of this dry mouth, and the symptom, again, can cause kind of pain or burning in the mouth. It can be very frustrating to have dry mouth. It can make dentures not fit as well because we really need that saliva to help hold dentures in the mouth. It can be hard to eat because saliva, again, helps move food around in the mouth. But it also has an increased risk for getting cavities or caries or decay in the mouth. So again, saliva typically is a really protective factor in our mouth. It kind of naturally rinses out our mouth. It naturally brings the pH level from the acidic. Dr. Abdelaziz talked about the acids that are produced when we have food or sugar that interacts with bacteria in our mouth. So there's a lot of acid that's being produced in our mouth, and saliva is more basic, and it can kind of flush out and rinse and help protect against getting cavities. But if you don't have that saliva, then you're at a higher risk for getting cavities. So again, ways to manage this. Again, we can't really solve dry mouth, but we can manage it with drinking more water or rinsing out your mouth, increasing your oral hygiene or brushing your teeth after every meal. Bring a toothbrush with you. You know, you don't always need to have everything with you, toothpaste. Just take a toothbrush and just rinse it out, rinse your mouth out with water after you eat to kind of help flush the food and bacteria and things away from those teeth. The other thing you can use is over-the-counter products, like people might have heard of Biotine or other saliva substitutes, but those are really, really temporary fixes. They don't solve the problem, and so it's not often something I recommend because you're spending a fair amount of money for something that's really not helping. So I think really good prevention, brushing, rinsing your mouth out with water, are really key points here. Tongue cleaners are really good because they get the bacteria off the tongue. And again, dry mouth can sometimes create these deeper fissures or cracks in the tongue. And so cleaning the tongue is also really important. Well, a toothbrush can also do the same thing. It's just another device to clean the tongue. So I like to often say just good old-fashioned brushing, flossing, rinsing your mouth out are really the most important things. And then you can add on, other devices or products to use as well. We're going to have somebody else go into more of the oral hygiene practices, so I won't go into more detail on that. But something else you can do is use xylitol products. These are products kind of similar to fluoride, but they help decrease the risk of cavities. So a lot of gum might have xylitol in it, and we're really looking at non-sugar or sugar-free gum or lozenges, things like that to suck on to help promote the production of saliva in the mouth. And then, of course, you can go into medications that might help produce saliva, like listed here, pilocarpine, but that's something you'd want to talk to your physician about and whether that's something that makes sense for you. So again, these are some of the products to manage dry mouth, but again, I don't often recommend buying some of the over-the-counter products because I don't think they really work a whole lot, but I want to mention them. You can try them and see if they work for you. So again, talk to your physician about reviewing your medications. It's possible maybe they could cut down on the number of medications you're taking, but they might not be able to. Obviously you're taking a medication for a reason, but it is something that you can address with your physician as well as with your dentist. And again, brush or drink more water and brush more frequently. So another common condition is stomatitis, and this is kind of a general term, and there's more specific types of stomatitis, but this is really a sore or an inflammation in the gums or the cheeks or the lips, the roof of the mouth, or the floor of the mouth. It can be a fungal infection, so something called denture stomatitis is often a candida or a yeast infection. That's the one that you see here in the picture. That can be kind of bumpy, it can be very red, it can be painful, but it doesn't have to be painful. This is going to be easier. Yeah, and so this is caused because dentures are left in the mouth, maybe for too long, or they're not cleaned properly enough. So it's really important to every day, every night, take out dentures if you have them, partials or complete dentures. Brush them with a brush under running water. Give them a good scrub, and then soak them in a cleaner. And you want to leave them out at nighttime because your mouth really needs time to kind of be free of any appliance in your mouth. The tissue needs to breathe. So it's really important to take them out at night. If you've been wearing your dentures forever and not removing them at night, then I recommend sometime during the day you take them out for an hour or two and try to build up more time to be leaving them out of the mouth for longer periods of time. So you might not know you have a candida infection. A dentist or a hygienist would probably tell you because they're removing the denture from your mouth and looking underneath it. It is treated with an antifungal, usually a rinse that you have to rinse with several times a day for a week or 10 days. And then it's also important to treat the denture as well as your mouth because the source of that problem is the bacteria that's on the denture. Another is herpes stomatitis, or this is like a cold sore that you might have in your mouth. And another is an aphthous ulcer or a canker sore. And these can be caused from a series of different things. It could be spicy food. It could be maybe a change in the toothpaste. Sometimes a product in toothpaste called sodium lauryl sulfate can cause canker sores in the mouth. So if you're noticing these repeated sores, again, mention it to your physician or to your dentist and hygienist as well. Edentulosum, or complete tooth loss, is a loss of all of the teeth, and this can accompany kind of a loss in facial structure. So our teeth really keep the bone in our mouth, which also helps kind of fill out your face or keep the structure of your face and your lips. And so we're often trying to prevent the loss of teeth and prevent the loss of complete loss of tooth so that you can function well, but also keep and maintain the structure of your face and mouth. Some options to address complete tooth loss are implants, dentures, whether they're fixed, meaning that they're cemented in the mouth, or partial removable dentures as well. Ooh. All right, so the last one I believe is tooth wear. And this is when this can be caused by a number of factors. One can be the loss of tooth structure by a substance other than caries. So this could be like acidic things. Sometimes people might suck on something really acidic like a lemon or a lime or things like this, and it can erode or wear away the teeth. So that can be really on any surface of the tooth, wherever you're holding that lemon or lime or whatever else, that is wearing away that tooth structure. This can happen over time throughout your life. This can be through grinding your teeth or abrasion of your teeth with something hard. Sometimes people will chew or bite on bones, which might crack or abrade the teeth, or other types of food. So again, that's kind of the mechanical grinding or clenching of your teeth. Sometimes people at nighttime might not be aware of it, but might be grinding their teeth at night. Oftentimes we recommend an appliance or a night guard to wear to prevent that grinding overnight. And I already mentioned the chemical, which is the acid erosion, typically from food, that might be stuck on that structure. So on the top picture, you can see this is the mechanical grinding of the teeth. Those lower front teeth are really worn down. And on this bottom picture, you can see this abrasion of the tooth structure near the gum line. So all of the tooth is kind of hollowed out in that area. And so sometimes we might fill that with a filling to help protect it, but some fillings won't stay in those areas because of heavy wear on the teeth. So the most important thing is to make sure these areas are cleansable and that we can then also address the issue that's causing that wear. So I'm going to pass it on to talk about prevention.
All right, so prevention methods. So when you go to a dental office, usually you will see a dental hygienist for your cleanings. So we help you improve your oral hygiene. We're all about prevention. A lot of what we do, while we're cleaning your teeth is talking to you, recommending certain things, and seeing what's best for your particular case. So just the basics here, a daily thorough dental hygiene routine is best long term. So this is, as we've gone over, brushing for 2 minutes. You really want to be taking the time. You don't want to be rushing through brushing. You don't want to kind of skim over things. So that's why we usually say that 2-minute mark. If you're doing about a minute on your top teeth, minute on your bottom teeth, you're slowly going through. This just kind of helps effectively brush. You want to make sure you're hitting that 2-minute mark. So you might notice on some toothbrushes, like electric toothbrushes, they'll usually have a timer. So you'll turn them on, they'll stay on for 2 minutes. So this can help you if that's an issue, if you feel like you're too fast. Another thing is flossing daily. So there are new types of things too, like water flossers or air flossers, water picks. You might have heard these words before or used them. But anything to clean around the gums daily in between the teeth. So these can be regular floss, the water flossers, or there's like floss picks, interdental brushes. There's a bunch of different things. So interdental aids, those are other things you can use if you've heard or seen them or used them. There's gingival stimulators. Those can be little rubber tip stimulators that you kind of poke in between the teeth. Sometimes that stimulates the gums, helps clean out that bacteria, just kind of disrupts what's sitting along your gum line. And interdental brushes, sometimes you'll see them. They might look like little Christmas trees. They're little picks you can stick between the teeth. And the little bristles get in those tight spots that sometimes your toothbrush isn't going to reach. And then there's different cleaning agents for removable dentures. There's little tabs that you can soak your denture in, and it just helps clean them. The same with partials or partial dentures. All right, so here's some visuals of a few different aids that you might see. So in that first picture, you can see regular string floss. There's a bunch of different types. There can be glide, which is a thinner floss. There's waxed floss. There's more ropier floss. There's floss picks. Those are those little handheld ones that you can kind of just get down in between the teeth. The only things with floss picks I feel like that I notice is sometimes it will clean the contact. So it will clean right between your teeth, but it doesn't clean that space that's down under. So when you use floss picks, I feel like using them, getting them down, and hugging each side of the tooth. So you want to hug each side, and that will disrupt that plaque that's kind of sitting underneath. So that's the only downside with those, but a lot of people like them because they're convenient. You can have them wherever. So I feel like they're a good option to have. And then just make sure you're using them and not just kind of popping them in and out. And then there's a picture of a water flosser. So these are a little more popular now. This is a picture of a handheld one. There can be bigger ones that sit on your counter. They can have a big tank of water. You can turn them on. They might have bigger or more pressure settings, things like that. But they just basically use pressurized water to flush between all your teeth. So how I tell my patients to use them is, hanging over the sink, you'll turn it on, it's pressurized water. You want to just kind of glide along your gum line. Even if you don't see exactly where you're spraying, it's pressurized. So it's just going to kind of blast all that bacteria out of there, food out of there. I have a lot of patients who say they'll brush, they'll floss, they'll use the water pick, and they'll still notice food coming out. So it's just another option for home care. I feel like they're great around crowns. They're great around bridges because you have that space where maybe food gets caught. Also implants just helps clean around those areas. All right. So nutrition and oral health go hand in hand. We touched on this a little bit before. But eating a wide variety of whole foods, so things that aren't processed, things that don't have added sugars, or oils, different things like that. Fruits, vegetables, and proteins are great. Another thing, too, is limiting frequent snacking. So what this does is if we're snacking through the day and just kind of eating often or not eating more meals, this can increase those acid attacks in our mouth. So with the acid attacks, our pH is higher, so that's increasing that cavity risk because those acids are just kind of hanging out in there. If we're not snacking as frequently, your mouth and your pH level comes down, so that just decreases that risk of cavities and not as much of the acids present in your mouth. So limiting liquid sugars. I feel like I see this a lot with coffees, or you go to Dunkin', or you're adding, different things, sodas, juices. Liquid sugars, sometimes they hang in those little tight spots. So you might be brushing, you might be, eating well, but if you're drinking a lot of liquid sugars, sometimes we'll see more common cavities starting between the teeth. If you're not flossing, especially, because those little sugars and acids, they'll hang right between your teeth where they're contacting. So that's just something to think about, as well as sticky gummies, candies, anything that's that extra sugar sitting in your mouth. It'll react with that bacteria and that acid. So this phrase I like a lot, sip all day, get decay. So that's, if you're sipping on those sugary drinks and you're not drinking them fast, you're just having acid attack after acid attack on your teeth. So drinking a lot of water, rinsing, those are really great habits to have. So some non-karyogenic foods, this means non-cavity causing, and they help lower your pH or lower your caries risk. These can be meat, fish, non-acidic fruits, nuts, milk, cheese, plants, vegetables, sugar-free sweets. So anything that's kind of staying away from, those processed sugars. All right. So here's just a checklist for maintaining good oral health, just some things to touch on. So this could be an option, chewing sugarless candy. If you're someone who likes that candy or that lozenge or that cough drop, sugarless is great, or xylitol. That is a sugar alcohol and helps kind of prevent, like we said before, fluoride. It just is another substitute to coat the teeth, and it's not sugary. So it's just something else that can stimulate the saliva production and protect the enamel. And especially if you have symptoms of the dry mouth, these are nice if you kind of like that lozenge. But like we said, it's only temporary. It's not going to help you all day long. Another thing is to make an appointment with your dentist if you have symptoms of chronic dry mouth. And this will, help us get on top of it, so we can kind of see if there's anything underlying, or if it is the medications. We would want you to also talk to your physician. Brushing your teeth every day with a fluoride toothpaste, and this helps prevent cavities. It protects the tooth enamel. Fluoride is a great addition to toothpaste, just because if you're doing that twice a day, it's reintroducing to the enamel, and what the fluoride does is it just soaks into that enamel and reinforces the strength. So this can help a lot with, preventing cavities, but also if there's early signs of cavities, it can either slow it or halt it. So a fluoride toothpaste is a great preventative daily thing we should be using. Using an electric or battery-operated toothbrush, I feel like in my practice, I recommend them to pretty much anyone, especially if dexterity might be an issue or getting to certain areas. The electric toothbrushes can do a lot for you. They do a lot of that work. So it's kind of, you're just guiding through the mouth, going slowly. You can tilt up towards the gums on the top, tilt down on the bottom, but you let the electric toothbrush do all that work for you. And like I said, it will go for 2 minutes. If you brush too hard, they'll usually buzz back at you to let off the pressure a little bit. So a lot of great benefits to electric toothbrushes. And there's a wide variety now. There's some that are really expensive, some that are more cheaper. So you can kind of find what's best for you. And I feel like with gum problems too, if you're getting that extra help from an electric toothbrush, sometimes we see a little more effectiveness cleaning along the gums. And flossing your teeth every day. So using floss holders, this is another thing too. If you have a hard time getting to the back teeth, there can be longer handles, almost like a toothbrush handle with a flosser on the end. Sometimes these can help you in certain areas if you have trouble getting to the back, or to certain if they're really tight. All right, a few more options here. Asking your dentist about prescription fluoride rinses or toothpaste or fluoride varnishes. So as a hygienist, I see this a lot where if someone has sensitivity or the early start of caries, we'll prescribe a fluoride strength toothpaste. So this is just a little bit higher than over-the-counter toothpaste, a little bit higher of a concentration. And we can see either a reduction in sensitivity, we can see reduction in cavities forming, or if there's early cavities, we can stop them in their tracks and maintain with an extra fluoride toothpaste. So something else we wanted to touch on, I don't believe Worcester has fluoride in the water. So you're probably getting it from, toothpaste or rinses. Is anyone using that at home? Rinses, toothpaste with fluoride? Yeah, some. Good. So that's just something, since if it's not in the water, that would be great to use every day as an option. You can ask your dentist about chlorhexidine. So this is a rinse. Sometimes it will be prescribed. It's a different type of rinse. So it's something too where it targets the bacteria. I feel like I always explain it as it targets the bad bacteria, but we don't want it to affect the good bacteria in our mouth. So chlorhexidine, sometimes we'll give it to you after scaling and root planing, which if you've ever had a deep cleaning, that's another word for that. Chlorhexidine targets that bacteria, but usually we only have you using it short term. But this is something you might have used before or you might have heard of, and just another option that you can ask your dentist about, or they might have talked to you about it before. So all older adults should have their dental cleaning performed whatever is best for them. Here I put at least twice a year. If you have periodontal disease, if you've had a deeper cleaning, you might be on every 3 months, which is very important. Yep, question? Okay, question is, what do you think of the new remineralizers that are out? So like a toothpaste? Those, a lot of the times I feel like they'll say remineralizing. If they have fluoride in the ingredients. What was that? Oh, nanny. Oh, okay. Yes. So that is another option. That's another ingredient that kind of works like a fluoride. So those are great. It's another, if you're, not sure of fluoride or you want to try a different product like that, I think it's great. That's in a lot of other dental products too. Sometimes we'll see from our office. And it's just a different type of ingredient. But definitely great. So that's good. I think I've seen it more in some of the toothpastes. But yes, good question. All right. So the dental cleanings, where was I? So 2 cleanings a year is what you'll see for a normal preventative cleaning. Like I said, you might come for a periodontal maintenance appointment after scaling and root planing, or if you've had a deep cleaning, if you've been numb for a cleaning. So whatever your dentist recommends, making sure you're staying on top of that. Here's another one too, if you have replacement heart valves or prosthetic joints. So this depends per surgeons, but sometimes they will tell you that you need to pre-medicate for dental treatment or dental cleanings. And this is to prevent serious infections. So as we talked about before with bacteria, if we're going in and we're doing a scaling and root planing, and we're stirring up all this bacteria in your mouth, we don't want it to travel through your body, and it can attach to those areas. It could attach to a hip replacement or knee replacement. So it's a way to prevent any infections and protect you. So every surgeon is different, and they kind of usually make that decision if you need to pre-medicate or not. So we always, I know as a hygienist, I always ask. I have little alerts on my patient's charts, and we make sure we stay on top of this to protect the patient. All right. So this would also be for some heart conditions too. We don't want that bacteria to travel and cause any harm.
I just want to end as prevention is key. So please see a dentist, a dental hygienist. We're so lucky we live in Massachusetts. Right here in Worcester, you have a dental hygiene school, Mass College of Pharmacy. You have the health centers, and we have a list of them actually. Let's see. There's some there. QCC is another dental hygiene school. And right in Boston. It's not that far. You now have a commuter rail, which is awesome, that goes right to Boston. You have Tufts, you have Harvard, you have BU, you have community health centers. Please use them. We also have, if you have Medicaid, yes, in Massachusetts, we're very lucky that some dental benefits are under Medicaid. I'm sorry that Medicare does not have dental benefits, but guess what? I'm hoping in the future. I said the baby boomer generation is going to make the difference. And yes, so there is Mass Health Medicaid. So thank you so much. You're a great audience. And I want to thank all the presenters too. And please reach out to us. Don't hesitate to reach out. You are such
Just a few thank yous for this wonderful presentation today. Thank you to Massachusetts College of Pharmacy, dental students. Thank you to Harvard University. Thank you to BOMAC. Thank you to Lisa Laspina. Thank you so much. This was tremendous and a tremendous, tremendous event. Thank you.